Salivary glands produce most of the saliva, which helps in digestion, supports healthy teeth, and keeps our mouth moist. The major salivary glands are sublingual gland, submandibular gland, and the parotid gland. The parotid glands are the largest salivary glands. They are located just in front of the ears, around the jaw. Mumps is a contagious disease caused by a virus known as a Paramyxovirus, which also causes measles and other respiratory diseases. The Paramyxovirus causes swelling of one or both of the parotid glands, and the medical term for swollen parotid gland is parotitis. Mumps usually occurs in childhood in the absence of vaccination against mumps. The primary sign of mumps is parotitis. The other symptoms of mumps that might begin a few days before parotitis or swelling of the salivary glands include fever, headache, muscle aches, tiredness, and loss of appetite. In rare cases, mumps can cause more severe complications, especially in adults. Complications can include orchitis or inflammation of the testicles. This may lead to a decrease in testicular size or testicular atrophy, or temporary sterility or decreased fertility in men. Another complication of mumps is ooporitis, which means inflammation of the ovaries. Next is mastitis or inflammation of the breast tissue. The other complications of mumps include pancreatitis or inflammation of the pancreas, encephalitis, inflammation of the brain, meningitis or inflammation of the tissue covering the brain and spinal cord. Hearing loss or deafness can also be a complication of mumps. Rarely, mumps has been associated with abnormal heartbeat and diseases of the heart muscle. And lastly, contracting mumps during pregnancy, especially in the first trimester, may lead to miscarriage. Symptoms of mumps typically appear 16 to 18 days after exposure to the virus, but this period can range from 12 up to 25 days. Most people with mumps recover completely within 2 weeks. An infected person can spread the virus by coughing, sneezing, or talking, sharing items that may have saliva on them, such as water bottles or cups, and participating in close contact activities with others, such as playing sports, dancing, or kissing. An infected person can spread mumps from a few days before their salivary glands begin to swell to up to 5 days after the swelling begins. Mumps is highly contagious for about 9 days after symptoms appear, and a person suffering from mumps should limit their contact with others during this time. There's no specific medical treatment for mumps, and the disease must be allowed to run its course. To help manage symptoms, give the patient plenty of fluids and soft foods that are easy to chew. Don't give acidic fruit juices such as grapefruit juice, orange juice, or lemonade that can worsen the pain in the swollen parotid gland. To bring down fever or ease pain, you may give paracetamol or ibuprofen. Don't give aspirin to children with mumps, because children who are suffering from viral illnesses such as mumps who take aspirin can develop Reye's syndrome, a dangerous disease that causes liver failure, swelling of the brain, and even death. Ice or heat packs can help ease the pain of the swollen parotid glands. Persons with mumps should get plenty of rest. Children and adults with mumps should stay home for 5 days from the start of parotid gland swelling. Mumps is caused by a virus, so it can't be treated with antibiotics. Antibiotics work only against bacteria. Both adults and children with mumps symptoms should reduce contact with other people who live in their homes. Good basic hygiene practices such as thorough hand washing, covering the mouth when sneezing or coughing, and regularly cleaning often touched surfaces are also important in disease control. The best way to prevent mumps is to be vaccinated against the disease. Most people have immunity to mumps once they're fully vaccinated. The Mumps Vaccine is usually given as a combined Measles-Mumps-Rubella or MMR, which contains the safest and most effective form of each vaccine. 2 doses of MMR vaccine are recommended before a child enters school. Those vaccines should be given when the child is between the ages of 12 and 15 months and between the ages of 4 and 6. A 3rd dose of MMR vaccine is not routinely recommended, but your doctor might recommend a 3rd dose if you're in an area that is experiencing an outbreak. Thank you so much for watching our video. Please subscribe to our channel. Goodbye!